Hello guys, I am Vishnu. So here we are coming with part 3 video of drug of choice for microbial infections. As I said before, this is going to be a long topic which cannot be covered in a single video because the duration will get longer. So it will be good for your personal study as well, and definitely for the viewership perspective that it is divided into individual videos. So today I come with part 3. So today we will talk about antimicrobials of choice for selected infections, or if it is a particular antimicrobial, what is in which all conditions it is the drug of choice. So today we are going to talk about, we already talked about penicillin G, in which condition it's the drug of choice. We talked about amoebial infections. We talked about voriconazole. We talked about metronidazole, doxycycline, babesiosis, azithromycin, burn infection prevention, erythromycin, fluconazole, CESTODES infection, Chagas disease, Clostridioides difficile, amphotericin B, cryptosporidium, and dermatophytosis. And also we covered diarrhea. And the last topic that we covered was ceftriaxone. Today we are going to talk about itraconazole. So itraconazole is also an azole antifungal. So it is also used in, it is a drug of choice for some specific kind of fungal infection. So one is called mycosis. So mycosis is a kind of fungal infection, and sporotrichosis, which you can see in the pictures. If you are having enterococcal infections, based on the clinical scenario, the antimicrobial of choice may differ. So if you are having Enterococcus fecalis infection, we can use ampicillin plus aminoglycoside combination. If you are having Enterococcus faecium infection, you can use vancomycin plus aminoglycoside combination. Always remember, even if aminoglycosides are used in Enterococcus, aminoglycosides are usually active against gram-negative organisms in comparison to gram-positive. And if at all it is used in gram-positive infections, it is used in combination with some other antimicrobial. So in Enterococcus faecium, the combination choice is vancomycin plus aminoglycoside. If you are having aminoglycoside toxicity, or if you are having a risk factor for aminoglycoside toxicity, then you can use ampicillin or vancomycin plus ceftriaxone combination. And if you are resistant to ampicillin or vancomycin, then you can switch over to linezolid. So these are the different clinical scenarios, and based on the individual clinical scenario, we try to find out which is the appropriate antimicrobial of choice. If you are having gonococcal infection, so Neisseria gonorrhoeae, you know very well, it is responsible for a sexually transmitted disease known as gonorrhea. So if you are having a gonococcal infection, usually ceftriaxone is the drug of choice. But if you are having beta-lactam resistance, so ceftriaxone usually comes under beta-lactam antibiotics. So if you are having beta-lactam resistance, then we can go for spectinomycin. So spectinomycin is actually structurally related to aminoglycoside, and it is the drug of choice for resistant gonorrhea. So if you are having gonorrhea infection, which is resistant to beta-lactams, in that condition, you can move over to spectinomycin. Now, when we talk about hepatitis infections, in hepatitis infections, depending on which kind of hepatitis it is. So if it is hepatitis B, the drug of choice is entecavir. And if it is hepatitis C, the drug of choice is direct-acting antivirus. So direct-acting antivirus, the examples have been written here. So it depends on which kind of genotypic infection the patient is suffering from. So based on that, we can give the individual direct-acting antivirus. We can give sofosbuvir, glecaprevir, vibrentazvir, voxilaprevir, velpatasvir. Like that, there are a lot of direct-acting antivirals. Why I mentioned hepatitis B and C is because they are considered to be the most dangerous infections. and both of them have been related to adverse liver events. For example, it can lead to hepatocellular carcinoma, it can lead to liver failure, it can lead to liver cirrhosis also. Why I didn't mention about hepatitis A is because hepatitis A is also known as infectious hepatitis, and that usually happens due to poor sanitary conditions or unhygienic conditions. So that is why the treatment for hepatitis A is usually supportive care, and in few days itself, the patient gets recovered from hepatitis. But hepatitis B and C are very dangerous, and the treatment for such diseases usually take long term. So in hepatitis B, the drug of choice is entecavir. Obviously, we have to look at the resistance pattern, the tolerability profile, and all these things. So based on that, the antiviral may change. But generally, for hepatitis B, the drug of choice is entecavir. And for hepatitis C, it is DAA, that is direct acting antivirals. Now we come to herpes infections. So this is very surprising because I have mentioned some other herpes also here. So the three viruses that are mentioned here, HSV, VZV, and CMV. HSV is herpes simplex virus. VZV is varicella zoster virus, that is the culprit for chickenpox. And CMV is cytomegalovirus. So if you had a chickenpox incident before in your childhood or something, and you are having very poor immunity, if your immune status is very poor, it can be due to various reasons. Maybe you are suffering from diabetes, which can reduce your immunity, or you are suffering from any immunocompromised condition. Maybe you are having a HIV infection, or maybe you are under immunosuppressant therapy, or maybe cancer chemotherapy, or any kind of immunosuppression. Then you may get herpes infection also. And cytomegalovirus is also very commonly seen with HIV infected patients. So please remember that HSV, VZV, and CMV all come under herpes infections. So if you are having HSV, that is herpes simplex virus, or varicella zoster virus infection, the drug of choice is acyclovir. If you are having cytomegalovirus infection, the drug of choice is ganciclovir. And if you are having herpes infection, which is very resistant form, then the antiviral of choice is foscarnet. So these are the individual conditions, the clinical scenario, and the appropriate antiviral of choice. If we talk about Haemophilus influenza, so depending on which kind of Haemophilus influenza infection you are having, the drug of choice may change. If you are having Haemophilus influenza associated meningitis, it's a brain infection, then the drug of choice is ceftriaxone. If you are having Haemophilus influenza associated pneumonia or otitis, otitis is actually a middle ear infection. So you can have secretions from the ear coming or with severe pain and fever and all. So in that condition, ampicillin-sulbactam combination is usually used. And if you want to take a prophylactic medicine for H. influenza, maybe you came in contact with a patient who is having H. influenza infection, or as a prophylactic therapy for H. influenza, we usually give rifampin. Rifampin is actually an anti-tubercular agent, but it is a drug of choice for prophylactic therapy for H. influenza. And in the below, it is written the drug of choice for H. pylori. It's also known as Helicobacter pylori. So this is actually a bacteria that causes peptic ulcer disease. So if you are having Helicobacter pylori associated peptic ulcer disease, then we usually go for antimicrobial combination therapy. So we usually give amoxicillin plus clarithromycin plus proton pump inhibitor. But this can also change depending on the condition. Sometimes tetracyclines are also given, or we may give histamine type 2 receptor blockers. So that depends, but this is actually the common combination that is used for H. pylori infection. When it comes to influenza infections, so there are two types of influenza, that is A and B. So if you are having influenza A or B, then the drug of choice is oseltamivir. And if there is oseltamivir resistance, then we can use zanamivir. So influenza, you know very well, it's also known as flu. It's very common. It causes body pain and definitely cough, cold, and all the symptoms. So if you are having influenza A or B, then sensitivity based, you can use oseltamivir. And if oseltamivir is resistant, we can use zanamivir. Anyways, there are actually newer medicines also, but here we are talking about drug of choice. We'll come into those details later in future presentations. If you are having Legionella infections, so if you are having Legionella infection, Legionella is actually a bacteria. The drug of choice is azithromycin. And if you are a transplant recipient, that means you have undergone any organ transplantation, and there is a risk of Legionella infection or documented Legionella infection. In that condition, the antimicrobial of choice is fluoroquinolones. So actually the reason is in transplant patients, usually we use immunosuppressants, and the immunosuppressants that are commonly used in organ transplantation are calcineurin inhibitors. So calcineurin inhibitors examples are cyclosporin, tacrolimus, pimecrolimus, etc. The problem with azithromycin or any macrolide antibiotic is that they interact with calcineurin inhibitors and they can increase the level of calcineurin inhibitors. So if macrolides are used with calcineurin inhibitors, the plasma drug concentration of the latter may increase. So that is not favorable. That is why fluoroquinolones are used in transplant recipients for Legionella infections. Then we come to Leishmania infections. This is also not very common nowadays, but still it is present in many areas, tropical areas. If you are having cutaneous leishmaniasis, then the antimicrobial of choice is sodium stibogluconate. So cutaneous means you can understand very well, it happens on the skin. But if you are having visceral leishmaniasis, that means it is having systemic involvement, also known as Kala Azar. So in that condition, the antimicrobial of choice is amphotericin B. So actually this leishmaniasis is actually an infection. It's a condition which is spread by sandflies. So that is seen on the left-hand side. So sandfly usually is the vector that spreads it. And the parasite is known as Leishmania. Now, if you are having Listeria infection, so the organism's name is Listeria monocytogenes. So the antimicrobial of choice is ampicillin. But if the patient is allergic to penicillin, definitely ampicillin cannot be used. In that condition, you may use cotrimoxazole. So cotrimoxazole is a bactericidal combination of trimethoprim and sulfamethoxazole. Now, when we come to malarial infections, so there are different clinical scenarios. If it is aimed at treatment and prophylaxis, then we can use chloroquine. But chloroquine is not used in Plasmodium falciparum malaria. So you know that malaria is caused by many organisms, many parasites like Plasmodium falciparum, Plasmodium malariae, Plasmodium vivax, and Plasmodium ovale. So if you are having Plasmodium falciparum associated malaria, chloroquine is not used. In remaining conditions, we may use chloroquine. If you are having Plasmodium falciparum infection, then you can go for ACT. ACT means artesunate combination therapy. So in that it means that we are using artesunate in combination with any other anti-malaria. So the oral artesunate can be given at 200 mg OD for 3 days. So that depends on the condition and severity, whatever it is. If you are having chloroquine resistant malaria, then for treatment we use artesunate combination therapy, and for prophylaxis we use mefloquine. If you are having very severe falciparum malaria, then we usually give IV artesunate. And for presumptive self-treatment of malaria, it is a combination therapy that is used, Atowacon plus proguanil. Now, presumptive self-treatment means, for example, you are living in a particular area where there is an endemic or there is a widespread malarial transmission. So there obviously there is a risk factor that you may also get malaria, or maybe you have been bitten by a mosquito or something like that. So in that conditions, presumptive self-treatment is usually used. So presumptive self-treatment is applicable to people living in areas of high malaria transmission. So in that conditions, the combination that we usually use is atovaquone plus proguanil. So that's it that in this part 3 that I want to discuss. The remaining we will come in part 4. In that I will talk about more interesting facts about antimicrobials, their drug of choice, or for selected infections, what antimicrobials we can use. So for more information related to this, do like, do share, do subscribe, and please make sure that this message goes to maximum people, because we are working for you. And our intention is that maximum practical knowledge should get disseminated to maximum people around. So please support us in our process. And I seriously expect that you may have got a lot of practical knowledge from this. With high expectations, I will be back with another video tomorrow. Until then, bye to all. God bless you.